Lawyers announced today the framework of a $26 billion proposed settlement with the three biggest U.S. drug distribution companies and the drug maker Johnson & Johnson. The settlement is likely to be the biggest settlement in the unwieldy universe of opioid litigation. There are something like 4,000 lawsuits across the country brought by state and local governments that accuse companies of various roles in the opioid crisis that we've seen over the last 20 years in the US. The money in this settlement would be divided among the states based on their population, also the severity of drug crisis that we've seen in each state. And then it'll be up to each state to figure out how it would be distributed down to local governments and other entities. The idea is that it would be all used to abate the opioid crisis. Exactly how that happens could vary by state. We've been told by lawyers in the case there'll be a lot of flexibility because the way treatment works and the systems work vary by state. As part of the larger settlement, New York has also reached a settlement that would be worth more than $1 billion and ends the participation for the three big distributors in the current trial going on in New York's state courts. In thousands of lawsuits across the country, state and local governments have accused drug distribution companies, particularly, of sending drugs to where they're not needed, not flagging suspicious orders, sort of overfilling prescriptions. The companies have generally said that it's doctors who are prescribing, and that they are, filling legal orders. The Associated Press found in an analysis a few years ago, when some drug distribution data was released, that enough drugs were distributed in the US in 2012, one of the worst years of the crisis, to give every person in the country a 20-day supply of prescription opioids. Johnson & Johnson, which has settled a number of other cases as well, says it's prepared to contribute up to $5 billion to the national settlement, and that it wants to help be part of the solution going forward.